Hi everyone, this is Sumati Christopher from M College of Nursing. Today we are going to discuss about total parental nutrition, commonly known as TPN. In this session, we will discuss the introduction, the purpose of TPN, indications for it, the composition of TPN, and articles what are to be collected, and how the procedure to administer, complications, and the contraindications. Then we will move on to nursing management and the purpose of documentation. TPN, also known as intravenous alimentation or hyperalimentation, which involves intravenous infusion of highly concentrated solution of protein, glucose, and other nutrients by the form of nutrient solutions, which are administered into the parenteral route. This is administered when the feeding by way of gastrointestinal tract is not possible, inadequate, or hazardous. Now we will see the purpose of administering TPN. The first one is to supply nutrients to the body and to meet the nutritional needs of the child when the child is unable to feed orally. Next one is to maintain fluid and electrolyte balance. We are administering TPN. Here we'll see the indications to administer TPN. The first one is chronic intestinal obstruction from peritoneal sepsis and adhesions. Next one is inadequate intestinal length. In this condition, the short intestine will absorb the nutrients in inadequate manner. Next one is after major surgery or critically ill child, as a prophylactic measures, we are administering TPN. Chronic diarrhea, protein energy malnutrition, extensive burns, abdominal tumors treated by surgery, irradiation, or by chemotherapy. Multiple fractures, prolonged starvation, severe sepsis, we are administering TPN to nourish the child. Here we'll see the composition of TPN. TPN bag is a solution of highly concentrated dextrose, amino acids, lipids, vitamins, minerals, electrolytes like sodium, calcium, magnesium, chlorides, phosphates, and trace elements like copper, zinc, manganese, and chromium. Articles needed to administer TPN are: first one is PPE, that is the personal protective equipments, towel pack, sterile dressing pack, sterile syringes, 3-way with extension, infusion set with filter, IV stand with basket, adhesive tape and scissors, laminar flow, label, sterilium, and clean trolley. The procedure to follow: according to the child's weight and the degree of malnutrition, as per the physician order, calculate the amount to be administered, explain the procedure to the child and the caregiver, do the hand scrub with soap and water, follow aseptic technique throughout the procedure, check the glucose level and the lab results, collect and arrange the articles, check the TPN bag for color, consistency, date of expiry, do the hand rub with sterilium, then open the dressing set in sterile manner and place sterile needed articles inside. Wear PPE, load heparin flush in sterile manner to flush the central line. Prepare the site with chlorhexidine, then place the surgical towel underneath the line, connect the IV infusion set to the TPN bag, prime the tube without air bubble, then connect 3-way with extension, flush to check the patency of the line, and connect to start with slow infusion. Observe the vital every 5 minutes for 15 minutes. Possible complications of administering TPN are hypo or hyperglycemia, metabolic or fluid imbalance, pneumothorax, thromboemboli, sepsis, hyperbilirubinemia, fatty liver, azotemia. Contraindication to administer TPN or hyperbilirubinemia, azotemia in shock, respiratory distress syndrome, thrombocytopenia, extreme prematurity. Discuss the nursing management. Follow aseptic technique during entire procedure period. Monitor the vital signs every 5 minutes for 15 minutes, then every 30 minutes. Check for any allergy, signs of infection. Monitor the serum glucose level periodically. Q2H intake and output to be monitored. Keep the articles ready for the emergency management. After the procedure, replace the articles, do the documentation with the details of starting time, amount of fluid, drip per minute, time duration to be infused, and any adverse reactions about the vital signs and the general condition of the child. Thank you. See you next time.